attending this on a Friday morning. My name is Ravi. Before I begin, I wish to thank each one of you personally on behalf of the founder president of this institution, Mr. Thumbay and our academic leadership and the GMC hospitals, specifically the presence of our medical director, healthcare operations, Dr. Manveer Singh Walia. It's always inspiring for us in the group, as well as I wish to welcome Dr. Prashant Hegde, the Chief of Medical Staff at GMC Hospital, who will be chairing this session today. A very warm welcome and a special greetings to each one of you who are here for the Medical Meet 2013 at GMC Hospital, Sharjah. As you are all aware, this is an idea which is very strongly backed and personally made possible by Dr. Samir. So I welcome him to this gathering without taking much of your time, because it's a Friday morning and I know before the prayer time we need to finish the seminar. So while welcoming each one of you, may I request Dr. Prashant Hegde to please take over the session and conduct the scientific part by introducing the speakers of the day.
The first session for the day is an orthopedic talk from our senior doctor, orthopedician, Dr. Praveen Kumar Pandey. I am happy to present Dr. Praveen Kumar Pandey. He has done his MBBS in 1982 from MLB Medical College in UP, India, and he did his masters in 87 from the same college. Since then he has worked in various hospitals in UK, India, UK and Saudi Arabia, and even in Qatar. Today we will be talking about pathogenesis, symptoms, diagnosis and treatment of osteopetrosis. So, Dr. Praveen Kumar, I welcome you for the proceedings.
Important to recognize, and more important to recognize in time to avoid any complications which are serious and even fatal. Now, this disease was first of all recognized by Albert Schoenberg. He was a German radiologist in 1904, and the disease is also called after his name. In this is a disease in which there is generalized eminent sclerosis. The bones are as hard as ivory and marble. It is also called osteosclerosis fragilis congenita. Now the word marble is looks like a good word. Marble outside the body, you see it is beautiful and wonders are created out of it. But if it occurs inside our body, it becomes a disease. It's an inherited disorder in which the bone hardens, is denser and more brittle. As it is inherited disorders, it is important to recognize at the time of birth, and now it is possible even to recognize even before that. How it happens? Actually, in normal bones there is a balance between osteoclasts in the improper formation of the cavity of bone marrow, which is important for all development of all the stem cells, all the erythropoietic system, all WBC, RBC, all these structures, platelets, so they have like a heartbeat. Now all these structures which are connected to each other with thread-like structure, these are collagen fibers. So these collagen fibers, they function properly. So there is a lot of bone in just empty spaces. It looks hard, it looks more strong, but it is chosen because this has shown a very clear-cut collagen structure.
Vitamin D functions as a hormone. The biologically active vitamin D is 125 hydroxyvitamin, and which acts as a hormone controlling the metabolic way, it acts as a mediator of cells signaling, regulators of cells, tissue growth and differentiation. B-complex vitamins functions as precursors for enzyme cofactor or biomolecules that help and act as a catalyst and substrates in the growth. Vitamin D. The natural form of vitamin D is cholecalciferol. It is a modified steroid. It is a corticosteroid. This is the chemical formula of the active, as all of us know. And the deficient in diet causes defects from defective mineralization of growing bones and osteomalacia in non-growing bones. Speciality of although vitamin D is commonly called vitamin, it is not actually an essential antivitamin in stem cells, as it can be synthesized in adequate amount by most of plants exposed to sunlight. And vitamin in humans, vitamin D is unique because it can be ingested as cholecalciferol, that is vitamin D3, or methylcalciferol, vitamin D2, and vitamin D2 electrocytes. There it is incorporated in hydroquinones for taken into liver. In the liver, vitamin D also decreases vitamin D synthesis. As in the metabolism and absorption for calcium. Condition was well documented and unfortunately scientifically proven cause of it was not.
We wish to thank her profusely for accepting the invitation on behalf of GMC Hospital, Sharjah, and it's indeed always an honor to see her amongst us during such occasions. Ladies and gentlemen, may I request Dr. Salma to kindly greet and welcome our Provost Professor Geeta Shokraj by presenting the bouquet. Dr. Manvi Singh Walia and Dr. Prashant. Thank you, ma'am.
Ever smiling, ever charming, enthusiastic support that we all.
Anything making them go up and down.
By surprise, and always happy to be gathering where academicians come together and share their expertise and experience with those who translate this knowledge and skill which we teach or train our undergraduates and finally become future practitioners. Because we see the medicine which we learn being practiced in daily lives. So it's actually a process of translating what we learn into practice. And it is only the practitioners who ultimately provide the service to the community. So the link between the community and the training which goes on are the practitioners. So we are really happy to see a good number of practitioners who have come in and are spending time to listen to the recent trends which are there or which are evolving in their own, our own students. And it is not, your learning is not going to end when you are awarded your degree. In fact, once you get your degree, you're only starting your learning or putting it into practice, what you have learned. You will be lifelong learners, expected to do self-directed learning all your lives. It may be in the form of attending ACL, which is now become a practice in most countries and also provides an easy way of listening to the recent trends which are happening in our own fields. But there is also in our own area of expertise who may have come across such a case. And eventually we look for this information in the available resources, particularly the net. And once we get this new information, we again decide how best we can apply it to our practice. And what is today termed as evidence-based practice. So I would like to only say once again that it gives me great pleasure to see our practitioners very active, wanting to improve their own knowledge and listen to
Thank you for your presence. As ma'am said, the importance of CME I wish to mention that this is the 211th event that's being held by our university or in the hospitals. I always feel proud taking the count forward, and every time we do an event, it's a matter of pride. But specifically for this group, I wish to profusely thank each one of you for being here. This shows that it is with all sincerity and your attachment to the profession. It is evident that you are all such.
That this condition is finally today. Are we going straight to the level of vitamins? Before that, a few words about the vitamin D yesterday. It was fortuitous that a person like me, a cobbler, who actually discovered vitamin D about a century of important. We all know some. I'm no time. We all have important in our childhood. So this was actually in 1922. He discovered vitamin D. Already in 1914 it was understood. 1922, ABC were all discovered. So he patented vitamin D by doing a trick. He invented vitamin D from liver and kidney. Now coming straight to the at the cellular level, and it has got a law that been identified. There are some variations which is below. Try to increase the level of calcium by one is enhancing the form so that it actually parts are showing any time specialists. They are here to, we are just a phone call away, just give us a call, and for anything, we are always there for you. And I have been diagnosed with vitamin D deficiency. Mine was 4.6. So I'm on regular medication. Dr. Pandey and Dr. Sharjah both have been, I'm lucky to have two specialists taking care of me, but same thing, we have to transfer to our patients. So thank you very much once again.